Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. First up, newly published data from an open-label extension of the 12-week CO13 study showed significant long-term retention of adjunctive cenobamate for up to 7.8 years in adults with treatment-resistant focal epilepsy taking 1 to 3 anti-seizure medications. The multi-center, double-blind, placebo-controlled open-label extension included 149 adults with uncontrolled focal seizures who had median treatment duration of 6.25 years with cenobamate. As of the data cutoff of July 2019, 57% of patients remain in the open-label extension, and the median modal daily cenobamate dose was found to be 200 milligrams. Based on Kaplan-Meier analysis, the probability of continuing treatment was 73% after 1 year, 67% after 2 years, 63% after 3 years, 61% after 4 years, and 60% after 5 years, and 59% after 6 years. Among patients who continued treatment after 1 year, the probability of continuing treatment was 92% after 2 years, 87% after 3 years, 83% after 4 years, and 82% after 5 years. Next up, a nationwide cohort study in Sweden found patients with multiple sclerosis face subsequent risk for depression depending on the disease-modifying therapies employed in their treatment regimen. The use of antidepressants or depression diagnosis showed limited associations with discontinuation of DMTs and MS relapse. A total of 3,803 patients with relapsing remitting MS were included in the study, which spanned 8 years and drew data from the Swedish MS registry. Compared to those treated with interferons, investigators found a lower risk for depression diagnosis or initiating antidepressants in patients taking rituximab. Patients with depression more often discontinued the use of interferon treatment compared to those not diagnosed with depression. Lastly, an exploratory analysis of the Thales clinical trial showed that patients with moderate ischemic stroke consistently benefited from a dual antiplatelet therapy, or DAPT, of ticagrelor plus aspirin compared to patients with less severe ischemic stroke with no increased safety concerns. Ticagrelor previously received FDA approval in November of 2020 to reduce the risk of stroke in patients with acute ischemic stroke or high-risk transient ischemic attack. The Thales trial was the basis for the approval, in which approximately 30% of the patient population had National Institutes of Health Stroke Scale, or NIHSS, scores between 4 to 5. The primary outcome, time to stroke or death within 30 days, was observed in 7.6% of patients with moderate stroke for those in the ticagrelor group and 9.1% for those in the placebo group. Additionally, the primary outcome event rate in patients with less severe stroke was 4.7% for those in the ticagrelor group and 5.7% for those in the placebo group. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.